Hi there and welcome to this video, which was prompted by a paper that came out just recently, and I've highlighted it here over to the side. It was in the European Heart Journal of Acute Cardiovascular Care, and the message which came out and was widely reported in the press recently was that about 1 in 3 of people who have a heart attack are initially misdiagnosed. In other words, when they go to the doctor or to the practitioner they're seeing, whether it's a chiropractor or whatever, it's thought that they have something else other than a heart attack, and so they're given the wrong treatment. And so the bottom line was 1 in 3 people initially who have a heart attack, the diagnosis is wrong, whoever they go and see. Now, one of the problems with this is knowing when people are having a heart attack, because one of the symptoms often of having a heart attack is having pain in the left shoulder. And obviously chiropractors see lots of people with shoulder pain, left shoulder pain, right shoulder pain, pain coming down from the neck, and this makes it difficult sometimes to know whether someone's having a heart attack. And this is the dilemma that all clinicians face, whether it's the GP or the chiropractor. Now, a lot of the pain that chiropractors see will emanate down from the neck here, the left side of the neck, and will spread down into the shoulder. So when we're examining patients, we're looking for evidence of problems with the neck, and we're also moving the shoulder around and seeing if there's a problem with the shoulder itself. And mostly when there's pain just at the back, one can be much more happy that the problem is a mechanical problem, the sort of thing that a chiropractor may well be able to help. We see lots of people with shoulder pain. But if the pain comes to the front and the pectoral muscle is here, if the pain is in this pectoral area, then I think it's something that all clinicians, whether they're a chiropractor or a GP, need to be concerned about and need to be thinking about further investigations. And the sort of thing that one might need if we're suspecting a heart attack is an ECG, some blood tests, and possibly an angiogram to see what the blood flow around the heart is like. And it's not at all easy, of course, to do this in a chiropractic clinic or indeed in a GP's practice. And so there's often quite a difficulty for the clinician in knowing absolutely whether a person's having a heart attack or getting angina, where the blood supply to the heart is a bit limited. And one might think that taking the blood pressure and listening to the heart would answer all these questions, but often it doesn't. People with heart attacks often have normal blood pressure, although if the blood pressure is higher, that does increase one's likelihood of having a heart attack. But if the blood pressure is normal, it doesn't rule out the fact that someone might be having a heart attack or have had a heart attack recently. And if you listen to the heart, it can often sound normal, and the pulse can be normal as well. So it can be quite tricky, but certainly my feeling is that if a patient gets pain at the back of the shoulder and isn't getting any pain at the front of in the pectoral area, one is much more likely not to have a heart condition. But if there's any pain at the front, certainly pain that's brought on with activity, where the heart needs more oxygen and it's struggling to get it, this can often make this sort of pain worse, crushing pain at the front of the chest. Sometimes heart pain is worse after eating and in cold weather. So again, those are things that chiropractors would be looking to see whether that may be an aggravating factor. So bottom line, basically, as is most shoulder problems, have mechanical issues, and these may well be helped by treatment from someone like a chiropractor, treatment to the shoulder joint, treatment to the neck. But some shoulder pain does come from other things, like the lungs. If there's trouble in the lungs, that can give pain in the shoulder, and problems from the heart. So if people are having angina or heart attacks, that can give shoulder pain, but more typically it will give pain in the front of the shoulder, and those are the people that we like to have investigated. If the pains come on very suddenly and is very recent, then often those patients will need urgent examination. So if you get shoulder pain, particularly at the front of the shoulder, very suddenly, and you're at home, it's an ambulance. So dial 999. That's what you want. If you're worried that there may be a heart attack, and pain at the front of the chest here is what tends to make us suspect that much more. But it's not always like that. It can be difficult. and sometimes we do have to send people on for heart investigations, and sometimes the heart specialist will say to the patient that there's nothing wrong, and sometimes they will find problems that they know that the patient has had a heart attack, and they would then need more medical type of treatment. So anyway, it was an interesting paper, fascinating to see that 1 in 3 heart attacks are misdiagnosed. As I say, chiropractors do see people with heart problems who come in with shoulder pain, and we're always on the lookout to see whether people need to have urgent medical assessment. So thought you'd be interested. I thought it was a really interesting paper. So catch up with you soon. We're in Abingdon. These are our details here, and we're here to help you. So thanks for watching. Bye for now.